Hi, everyone. I'm Kara Sundlin, and this is Today in Connecticut History. 1 year ago, on January 28th, 2021, the state rolled out online vaccine appointments, and there were certainly some growing pains.
There are a lot of elderly people out there that don't have folks to help them.
Elise Bebo joins us by phone tonight because, frankly, she wasn't comfortable working a Zoom teleconference. The Enfield woman was one of nearly a dozen who reached out to Eyewitness News looking for help making a vaccine appointment. She was doing this for her 93-year-old father-in-law.
I started out with the phone call because I figured that would be easier, and it turned out to be a total disaster.
A recording popped up.
If you don't want to wait, give us your phone number. We'll have someone call you back within the next 24 hours.
It's been 6 days, and she says no calls have come. She ended up going through the VAM's website, and even that proved to be a headache. Her father-in-law lives in East Windsor, and Bebo says no appointments popped up, so she found a workaround.
I tried the zip code for East Hartford, and lo and behold, I got a whole different readout of different locations.
Her experience has not been unique, and it seems like the governor's office has heard about it too.
I got it. I don't like vans. I don't have email. I'm not very good on the internet. So we've expanded the telephone.
The 877 number is the same, but now there are 80 more people taking calls. The governor says wait times are now down to 3 minutes.
I understand how important that is, especially for those who are older.
There will also be 6 additional sites statewide that can be booked over the phone. All other appointments may need to be completed online.
They need to really reevaluate it because it's not working.
5 years ago, victims of Connecticut's Crumbling Foundation epidemic were still waiting for financial relief, and frustrations were mounting.
A year and a half later, we're still in the same position. People's homes are getting worse.
Homeowners in limbo met with local officials today to talk about solutions, hoping to finally have an answer to what's going to be done to help those dealing with crumbling foundations underneath their homes.
I want to show the victims what I see every single day. Town leaders, CROG, senators, legislators working very hard to try to help us victims. It's a very important day because there's 19 bills being proposed for legislation.
Thousands of homes in the state could be affected by the tainted concrete.
The problem is there's almost 500 DCP complaints right now, totaling about $100 million. You know, there's been about 1,000 homes that the engineers have been in. So right now we're looking at about $200 million in damage, and it's only the beginning.
Tim Heim is president of the Connecticut Coalition Against Crumbling Foundations. He is also one of the homeowners impacted.
Even if you don't have this problem, you're still a victim. You know, we're the middle class. We paid for everything. We paid our bills. We paid our taxes. You know, we pay for all the services provided by the state of Connecticut. And then when the middle class needs help, we're being ignored.
Heim says something needs to be done to make sure this doesn't happen to other homeowners in the future.
The concrete company is off the hook because of a 10-year statute of limitations, so there needs to be some bills to be changed to stop this from moving forward, not only on a state level but a national level.
8 years ago, it was a big step forward for medical marijuana. State lawmakers voted to legalize it, and 4 growers got licenses to start producing the plant. Channel 3's Courtney Zeller had the story.
Out of 16 applicants, only 4 growers have been chosen as the first ever producers of medical marijuana, all to serve very sick patients in Connecticut whose doctors have certified they need it.
For years, I have heard stories from people considering the benefits of medical marijuana who desperately want to follow the law, who desperately want to follow the doctor's advice, and who desperately want relief from the pain or debilitation of the disease they are suffering from.
There are more than 1,600 patients in Connecticut who qualify for medical marijuana. This is a breakdown of how they're spread out around the state. The state-of-the-art production facilities will be located in Portland, Simsbury, Watertown, and West Haven. We headed to Portland, where some people say there are some positives.
But I'm sure it's going to put some people to work, so that's a good thing.
The 4 growers will create about 100 jobs. The growers will have to pay license fees every year and set up a $2 million escrow account. The companies must be up and running in 6 months.
We're looking forward to working with these companies to become operational as soon as possible. so that patients in Connecticut can get the benefit of pharmaceutical-grade medical marijuana at the earliest possible time.
And that's today in Connecticut history.